today I'm going to be preparing a histopath to be sent out to a outside lab. We have already taken our histopath sample and put it in our 10% formalin jar. On our jar, you want to make sure you label the date, the patient name, date of birth, their ID number, and the specimen source. There's always a spot on your formalin jar to do so. After you have that jarred and ready to go, you want to fill out your outside histopath form. This includes things as the collection date, their ID number, pet's first name, last name, sex, species, age, breed, doctor's information, as well as previous history or anything that would be important to be noted about the particular site or histopath. And then you also want to mark whether you have 1, 2, 3, and what kind of test you want to run on that. Once you have that all together, you're going to want to put it in your transport baggie. This one has 2 spots, one for the paper and one for the formalin jar. You don't want that formalin to leak out on your paper. Stick that in there. This particular sample does not need to be put on ice, so once we box it up, we can just leave it out on the counter and let it sit out until we're ready to pick it up. Seal it nice and tight. Put it in your box. Make sure your box is closed all the way and properly labeled if need be. Boxes that we get are sent from the lab, so they are already labeled for us. And our shipping materials also come from them, so we have a prepaid label, so that's already taken care of for us as well. Stick it in your bag. Put your label on it, and it's ready to go. So today I'm going to be cleaning the wash head on the HM5 CVC machine. I do this once a week to remove any salt buildup that would happen on it. So to do that, I go to the maintenance icon right up here. Push 1 for maintenance, 1 for cleaning, 2 for clean the wash head. It'll beep at us to open the door. Take a pre-moistened gauze with warm water. Gently wash off the wash head, shut the door, and hit accept. And that's it. Alright, so today I'm going to be running a canine ELISA antigen heartworm test. To do that, you want to take out your heartworm test, properly label it with your patient's name or ID number. So this one is for Knox. I already have my sample drawn. Once you have your sample drawn, you want to put it in a heparin or EDTA tube. Invert it a few times. Once you've done that, take the pipette that the test comes with. Take 1 small sample out of there. You want 1 drop of sample and 2 of your buffer solution. And then you wait 10 minutes for that to run. So this kitten came in for scratching her ears and shaking her head a lot, so we're going to check the ears for any ear mites or yeast infection or any bacteria in there. So we're going to stick our Q-tip down in the vertical canal and get as much of the debris as we can. To make our slides, we're going to make 1 for the ear mites and 1 for the cytology so that we can stain it. Once you get your swab of debris, just roll it out on your slide, and then we'll take this slide back and stain it, and then we'll make 1 for ear mites as well. So the kitten that we just took the swab on, we're going to go ahead and stain it now. We're going to use the Dip Quick Stain. First, you're going to set it in the fixative, and you'll just do 10 slow dips. That you'll go to the stain solution and do 10 as well. And lastly, go to the counter stain. And do 10 of those as well. that, just rinse off the back of the slide. You don't want to rinse off any of your debris. And I just dry it gently with a paper towel just to get that moisture off before I read it. Moisture is off, and you just put it on your microscope. We're going to be looking at the slide from the kitten that we took, looking for any sort of yeast infection or bacterial infection. To start with, you want to put your slide on your microscope and start with your stage all the way up top. And then you're going to start on the 4 objective lens. Start with your coarse focus and just get the slide in focus and look for any sort of purple dots on there. Once you have that in focus, switch it to the 10 lens. Get that in focus with your fine focus. And then go to your 40 lens. And then once you have that in focus, you'll want to go to your 100 lens. Before you do that, put your oil on there. And then switch it over to 100. Once you get that in focus, you can then look for your yeast infection or any sort of cocci or rod shaped bacteria. And this guy, it looks like he does have a yeast infection, so we will treat appropriately.
We're going to do a necropsy on a 12-week-old rabbit that presented dead, and we're going to try to figure out why it died. So we're going to do a postmortem evaluation on it with the assistance of Chase. So the first thing we're going to do is make an incision into the abdominal cavity to collect some postmortem specimens. Now that the abdominal cavity is open, we're going to look at all of the major organ systems and take a couple of samples to send to the lab. Take a sample of the kidney to start. Chase will grab some of the buffered formalin solution to put the sample of the kidney in. We're going to remove a small section of the kidney. We're going to take that piece of kidney and put in formalin solution to send to the lab. We're going to label that tube with the rabbit's name as well as the body part sampled. Next, we're going to take a small piece of liver from the rabbit. Size a small corner of the liver. And again, put that in a formalin solution.
I'm going to be talking about safety precautions and things that you need to do in order to submit and handle a rabies suspect. First, you're going to need some safety equipment to protect yourself and the doctor. Things including gowns or anything protecting your arms, as well as something to cover up your scrubs to prevent any brain matter, anything like that splattering on you. You'll want a face mask, pair of gloves, and then some some safety protection for your eyes, and then you'll also want a body bag to submit the body. For our purposes, our outside lab requires the entire body to be submitted. Things things that you'll want to do with the body is properly label the bag with the fact that it's a rabies suspect, as well as the patient information and the clinic information if needed. You'll also want to fill out a form to be submitted, which will also include the clinical signs of why you thought it was rabies suspect, how it died, whether it was euthanasia or died of other causes, as well as the hospital information and the patient information. I am going to do a vaginal cytology on this dog, determine which stage of estrus that we are in. So to do that, you want your cotton swab and a pair of gloves, and you're going to want to spread her labia with either your hands, or you can use a speculum as well. So you're going to want to insert your cotton tip into the caudal vagina, avoiding the clitoral fossa. Direct your cotton swab cranial dorsal into there and into the urethral orifice. Once you get that in there, you want to swab the vaginal wall to get as many of those cells as possible. Done with that, rub it across your slide, get those cells on there, and then we're going to let that dry and stain it. So for purposes of this video, I already had one pre-stained. We use the Diff Quick when staining ours. Different things that we're going to be looking for is which stage of estrus that we're in. There's 4 stages: proestrus, estrus, diestrus, and anestrus. In proestrus, we're going to see a mixture of epithelial cells and parabasal cells. You may also see some neutrophils and red blood cells. In estrus, you're going to see some superficial cells and occasionally intermediate cells. The superficial cells are going to either have a pycnotic nuclei, or it may appear anuclear. Diestrus, in this stage, you'll see a decrease in the superficial cells and an increase in parabasal and intermediate cells. The neutrophils may also be seen in this particular stage. In estrus, you're going to see parabasal and intermediate cells, and the intermediate cells are predominant in this phase. That's good. Today we're going to be doing the cross-match agglutination test to determine blood matching types for dogs. So what we started with is we got 2 different dogs, drew their blood, and went ahead and separated their blood between a serum separator tube and an EDTA tube. Once you get the EDTA tube filled, go ahead and set that to the side for now. Once your blood is clotted in the serum separator, go ahead and centrifuge it down. Once that is centrifuged, you can go ahead and pull it out and pull off the serum and put it in a separate red top tube. Very important that you label each of your tubes appropriately so you don't get their blood mixed up. I'm just going to use a small pipette to pull off that serum and place it into my red top tube. Cover that up. Make sure you're using separate pipettes so that we don't get any mixing of the blood. And once we get that in there, we can go ahead and set those off to the side as well. Next step in this process is we're going to go back to the EDTA tubes and go ahead and centrifuge those. Once you've got them centrifuged, you're going to want to go ahead and dump off that top layer of plasma in each of your tubes. And once you've got that done, we're going to want to wash the erythrocytes and the remaining blood. So what you'll do to do that is go ahead and take each of your tubes and take a small amount of that blood, place 1 to 2 drops into a disposable glass test tube for each one. Again, make sure your test tubes are labeled appropriately so we know which dog belongs to which. Once you have your blood in there, you're going to want to add, fill up the rest with 0.9% sodium chloride solution and mix with that. Once you've got that all mixed, gently mix it back and forth. And go ahead and place them in the centrifuge, and you're going to centrifuge them for a minute. Once that is done, you're going to go ahead and take them out and get rid of that supernatant that's on the top, and then go ahead and repeat that cycle 2 more times. Your thoroughly washed erythrocytes, you're going to want to make a 2% erythrocyte suspension. To do that, you're going to want 0.2 mils of your thoroughly washed erythrocytes and then 0.98 mils of saline. And you're going to want to go ahead and mix those together in a new tube. Mix them up gently. Again, properly labeling each tube. And once you've got those in and mixed, we can go ahead and begin our cross-matching. First, we're going to perform the major cross-match. In order to do that, we need the recipient serum and the donor's cell suspension. Once we have that, we're going to take 2 drops of each and go ahead and mix them together in a new test tube. After we've got those mixed in there together, go ahead and invert it gently. And the next one we're going to perform is the minor cross-match, which you'll actually need the opposite. You're going to need 2 drops of the donor serum and 2 drops of the recipient's erythrocyte suspension. Put a cap on that, and again invert it a couple of times and gently mix it. The next step in this process is you're going to want to make 2 controls, one for the donor and one for the recipient. In order to do that, you're going to want to take 2 drops of the donor's erythrocyte suspension and go ahead and mix it with its own serum, and then do the same with the recipient's. Once you've got those mixed together, you're going to want to go ahead and put them in your rack and shake gently, and then incubate for 30 minutes at room temperature. Once those have been incubated, you're going to want to go ahead and put them in the centrifuge for a minute at 3,400 RPM. Next, we're going to do a macroscopic agglutination, and to do that, you're going to want to take your tubes and go ahead and examine the supernatant in each tube. To do that, you're going to want to gently shake or tap with your finger and detect any grossly visible agglutination of erythrocytes, and there should be no hemolysis in your control tubes. Next, you're going to do a microscopic agglutination test. So to do that, you're going to want to transfer a small amount of your suspension to a glass slide and examine under low power on your microscope. If no agglutination is present, the erythrocytes will be evenly dispersed. If agglutination is present, the erythrocytes will be seen as grape-like clusters. Alright, so we're going to be performing a skin scraping on our patient here. When doing a skin scraping, you want to have things such as a dulled scalpel blade, and or gloves, just in case they would have something that would be zoonotic. When performing the skin scraping, you want to find a spot that has either a lot of hair loss already, or a particular spot that you might find a lot of mites. Pull the skin tight. Put your scalpel blade in between your thumb and your pointer finger, and at a 45-degree angle, being cautious not to cut them. Scrape with the hair, so you get some of that hair off onto your scalpel blade. If they're a longer haired dog, you may need to shave some of that longer hair down, but he is not, so we wouldn't need to do that. Get a good size sample, 1 to 2 inches, and then once you have that, you can make your slide. Alright, so we're going to be preparing our slide to look at it under the microscope from our skin scraping. So you want a new slide and then your sample from that skin scraping, and just go ahead and put it on the slide and add your immersion oil on top of it. Once you have that, gently kind of move those hairs around to separate them, so you can get a better look once you get it under the microscope. And that's it. So we have our skin scraping that we took from our dog prepared on our slide already, so we're going to look at it under the microscope. Once you have it on your microscope and ready to go, you'll start under the 4X objective looking at it. And when you're looking, for this particular dog, we're looking for things such as Sarcoptes or Demodex on pin. And if need be, you can also look at it under the 10X objective as well. Just be cautious not to get any of the oil onto those particular objectives.